So I'll be talking about menopause management other than what Dr. Deepthi has talked. At the outset, I must say that I always say menopause matters. But it's not a big stop, it's a pause. Pause for you to rediscover and discover how you can be productive. So I think whenever a patient comes to you without rushing for hormonal therapy, just listen to her. As we all know that the age of menopause in India is around 46. Understanding the landscape. How many people experience significant menopausal symptoms? This is overstatement when I'm making it, that 50 to 60% experience mild to moderate symptoms for a few months. Only 10 to 15% require pharmacological intervention. Why not start hormone therapy immediately? Because many symptoms will settle down with lifestyle correction, reassurance, and non-hormonal support within 3 to 4 months. What is the first prescription of menopause? I believe, and I am saying what I'm presenting. Listen to her. Allow women to talk about their fears, sleep issues, her body changes before prescribing anything. Wise counseling is as important as medication. Counseling reduces anxiety, improves compliance, and gives a sense of control, often eliminating the need of hormones. When she's convinced by you, you don't have to get worried. Look at me. Everything will settle down. Evidence-based non-hormonal interventions. What dietary advice should be given? Encourage plant-based diet. Soy proteins, Dr. Deepthi has just talked about. Calcium, this is emphasized time and again. Whether you're a gentleman or you're a lady, 1200 milligram per day is recommended, along with vitamin D, which is around 1000 international units, and you must take care of your hydration. You don't feel like taking any water at this particular time, so you have to time it and make it in a very proactive way, and if you help available, you tell them that, whether I like it or not, you must give a glass of water to me. How does exercise help? Whether menopause or no menopause. Regular brisk walking for 30 minutes or yoga reduces hot flushes, your mood swings, and insomnia. Madam has talked about the effective non-hormonal drugs for hot flushes. We could see few of the people mentioned about these names. Gabapentin is given for pain. आपको थोड़े सिम्टम्स उससे ठीक हो जाते हैं, पर जो आपको पेन and aches हैं, उसके लिए आप gabapentin देंगे तो it will definitely soothe your nerves. Have proven benefit for moderate vasomotor symptoms. I have my reservations. I have never used it. Should women take herbal or phytoestrogen supplements? Soya isoflavones, flax seeds, evening primrose oils may help mild symptoms, but ensure product quality and the safety part of it. How to manage sleep disturbances? Take time to tell her that you have to have a sleep hygiene, avoid caffeine and alcohol. Big no, and caffeine also should be after 3 o'clock. You should not take these stimulants. I find deep breathing exercise is a very, very effective tool, and as often you can do it, you should do it, but before sleep, a couple of deep breathing exercise does help. Short-term low dose of melatonin can also help. Sometimes you find a patient suddenly anxious, and you can give her these tablets for 3 to 4 days, and you'll find she gets into rhythm. Are calcium and vitamin D enough for bone protection? These are foundational. I think this is very, very important. I don't have to rub this particular topic again and again. Combined with weight-bearing exercises and fall prevention strategies at this time. What about the screening and prevention? What about the baseline screening is essential at menopause? Yes, big yes. You must, after thorough examination, do an ultrasound whole abdomen, mammography, blood sugar, lipid profile, and ask her to keep blood pressure records at home. You must order a whole body DEXA scan, and if the risk factors exist. I feel, I'm very fond of getting a DEXA done at 40, and I feel that, once she's settled for menopause, you must get it done baseline, and you'll know how frequently it has to be done. Why weight normalization be prioritized? I think each one of you should definitely dwell on this. Every 5 kg loss reduces hot flushes and long-term risk of diabetes, osteoarthritis, and breast cancer. Karke dekhe, and then know what I am saying is correct or not. Should NCD screening be the routine at menopause? Yes. Screen for hypertension, diabetes, dyslipidemia, thyroid disease, and for obesity. You must make them conscious about their BMI. What should be mammography begin? It begin as 40 or earlier if the family history. Repeat every 2 years till the age of 70 years. What is the role of pelvic ultrasound? When I say 70 years, people like us used to regularly go. So those people ask me, Doctor, बहुत हो गया, अब करने की ज़रूरत नहीं है आपको. So this is what I'm trying to say. Once it is 70 and you have been normal, you should take it when it has been normal, you take it as no. What about the role of pelvic ultrasound to rule out endometrial thickness? I think this particular part is important. Some people take cutoff as 4, some people take cutoff as 5, and ovarian cyst should not be overlooked at this particular time. Lifestyle, mind, and your emotions. How to address mood swings and irritability. Validate feelings, teach mindfulness. And this just mindfulness becomes, it's a big medicine. Encourage social interaction. And in case if there is a need, be short-term SSRIs. If persistent symptoms are there, you can take. Why emphasize hobbies and creativity? Hobbies rechannel your emotional energy. और दिमाग एक समय पे एक ही चीज़ पे काम करता है. हर 1000 चीज़ों पे काम नहीं करता. तो once you focus yourself in something else, it will reduce your isolation. It will restore your self-esteem. It will be powerful non-drug therapy. How to counsel about sexual health? Explain that some mild vaginal dryness will respond well to lubricants and moisturizers, not necessarily estrogen creams. Again, you have to try it out before you say it doesn't work. How to improve self-image and confidence? Encourage posture, grooming, new learning, and connecting with peers or women support groups. What role does the partner communication play? Open discussion with partner about the physical and emotional changes enhances your intimacy and understanding. Rational use of hormonal therapy. I think this has been emphasized to you people time and again. For very severe vasomotor symptoms, and whenever you have premature menopause, that is earlier than 40 years if it occurs, or there is a gross osteoporosis, non-responding to non-hormonal therapy, you have to give HRT. How to decide on the safest HRT regime? Use the lowest effective dose for the shortest duration after ruling out contraindications, which Dr. Deepti just now detailed it. What about the absolute contraindications? The history of breast cancer, thromboembolism, liver disease, and unexplained vaginal bleeding. How to monitor the patient with MHT? Review every 6 months, must see her blood pressure, breast examination, endometrial assessment again, and counseling. What are the alternative to systemic HRT? Local vaginal estrogens, non-hormonal lubricants, or selective estrogen receptor modulators Dr. Deepti has overemphasized. Coming to the holistic and public health approach, why is menopause a window of opportunity? It's the best time to screen for NCDs, reinforce healthy lifestyle, and promote. These are enough to promote longevity. How to integrate menopause care in the routine OPD care, create a menopause corner with counseling charts, screening checklist, and referral links. How to educate women about the natural transition. Reassure menopause is not an end, it's a new beginning for self-care and reinvention. Why involve family members? Do involve spouse and children, and I think they improve empathy, reduce stigma, and ensure support at home. What is the ultimate goal of menopause care? Not just symptom relief, but healthy aging, emotional balance, empowerment of every woman over 40 with menopause. Key messages to all gynecologists here: don't treat menopause, guide women through it. When we spend time in listening, screening, and empowering, hormone becomes optional and not essential. So I will say, menopause is not a full stop, it's a comma. It's a pause to recharge, rediscover, and remain productive. Thank you very much.